The New South Wales Council of Social Services held a COVID-19 risk assessment webinar on the 18th of November 2021. The session was for non-government organisations that are subject to the Department of Community and Justice's COVID-19 management and vaccination policy for DCJ service providers. The session began with an acknowledgement of First Nations people and paid respects to elders past, present and emerging. The session covered the Department of Communities and Justice's requirements, how to use the NCOSS guide and tool to think through risk and mandatory vaccination options, frequently asked questions featuring Alison Plant of Ask Insight, Savi of Justice Connect and Michelle Dowd of DCJ, as well as looking briefly at resources and support options. DCJ requires funded services to follow its COVID management and vaccination policy. Organisations have duties under work health and safety legislation to take care of the health, safety and welfare of workers, contractors, volunteers and others, such as clients, customers and visitors. By the 22nd of December, funded organisations must have a documented COVID-19 management plan, which includes a risk assessment for each service setting and a plan to respond to identified risks, as well as a business continuity plan to manage a COVID incident. Your management plan will need to be on file. DCJ and Rebit consultants have developed a guidance manual to help services do their risk assessments. For the guidance and recordings of those workshops, go to the DCJ website. NCOSS has developed resources to assist services undertake their risk assessments. It includes a guide, a worksheet, and a resources document. We now pick up the presentation by Alison Plant on how to use the toolkit. This is followed by the panel discussion of frequently asked questions with Savi and Michelle Dowd.
Even if you're covered by these legal requirements, you still need to arrange to consult your team. This is a standard adjustment to people's operating conditions. It's a work health and safety requirement. So you follow the good practice that you've already got in your policies and procedures, and you involve people in talking about what are the risks, what controls have we got, what's working, what's a nice idea, but actually in practice isn't practicable. And those things then get documented within your risk assessment. Really want to underline this consultation piece because the staff will tell you what works. The volunteers will be involved as well and have their own views. It doesn't mean that everybody has to agree with what the leadership of the organisation and the management committee effectively land on, but you will have to demonstrate that you've had a genuine and robust consultation process that allowed people to express their views and contribute ideas, and that those ideas are taken on board wherever possible. So we're going to talk some more about this, what kind of questions you might be asking in a risk assessment process. And I like doing this kind of stuff with groups of people so they can, all answer the same questions, and you can look at where people agree and where people don't agree. So you can use the tool that we've developed that way, or you can get a small group, your representatives, to draft something and then test it or survey people, whatever makes sense for your organisation. And then the last two areas, we don't really go on a great deal of detail in our documentation or in the guide, because we focused on the risk assessment. But considering the implications of any decisions that you make in terms of contracts, in terms of changing policies and procedures, in terms of record keeping and monitoring processes, is pretty critical. And then, of course, it loops back to say, how do we check how we're going with this? Are the controls we've got in place working? What do we need to revise? Are there changes that are happening? Because obviously things are moving pretty fast in the outside environment, and there may even be new public health orders and so on further down the track. So just keeping that loop going is important. Okay, we've got some more questions in the chat, which I'll encourage Megan to let me know if there's something I need to stop at. Okay.
So, Alison, there was a question,
yeah,
which was, should the consultations be one-on-one for privacy purposes?
I think in terms of the risk assessment, the general risk assessment, I don't think they do need to be one-on-one. I think if people are offered an opportunity to come to talk to you, if they've got vaccine hesitancy or health issues, it would be good practice to have a bit of an open door session. But I think overall a transparent approach in this space is important, because everybody is going to have to be part of protecting each other, work health and safety obligation. Managers need to create a safe working environment, but I'm also responsible for the health of the colleagues and the clients that I'm interacting with and so on. So that would be my take on it, but it may be something that Savi wants to pick up on when we come to the questions and answers at the end. One of the things I guess I was going to say later on, but when you're thinking about these kinds of risks, it's a classic case of a management problem rather than a puzzle. And what I mean by that is that a puzzle is like a crossword puzzle. It has a right answer, and if we just work really hard at it, the right answer will pop out at the end. Whereas these are classic challenging problems, and we can only make the best decision that we can make given the information that we've got available, all the research about vaccination, all the research about prevalence in your particular area, everything that you know about the profile of the people that you work with, and the nature of the work and the best way of doing the work. So you're juggling all these different things, and you make the best decision. You document it through your risk assessment and then your management plan. And then if you need to revise it because you've got better research, more information, the privilege of time under your belt, then you can move forward. So I'm going to talk you through this sort of 11 stages, I suppose, of risk process. I'm describing it as linear. It is to some degree, but there are areas where once you've done a piece of work, you may want to kind of come back and revise it. So that's the summary, and the headings on those 11 areas match what we suggest you talk through and document, either using the spreadsheet or your own document. So our process, sorry, I flicked too fast. Our process starts really by inviting you to think through on a cover sheet, what is the purpose of the organisation, what's the mission, and who are our clients. And the reason that we start here is that, in an ideal world, you may not have anybody come through your door who's unvaccinated. That might be the safest way of looking after your staff, but it's actually not why you exist. Most organizations that are part of these conversations with us are here with a mission and a purpose that's about being there for a community, and a community of people who are vulnerable, who have compromised health, who have lots of challenges going on in life. So understanding that starting point, that you are providing, in many cases, emergency services for people, means that the conversation about risk and controls is very different from an environment where you can just close your door or do everything remotely. So that's the first set of questions. The blue text on these slides is just a small example. I'm slightly worried we're going to kind of go down a big rabbit hole in terms of the accuracy of my made up world. But it's just really to show you how the kind of questions operate and what sort of things you might think about if you were having this discussion with your team. So in this hypothetical organization, it's a community use service, does a lot of work with couch surfers and at-risk youth. Some of those young people might have trouble navigating paperwork, some of them might have been kicked out of home and don't have their own Medicare card or access to identification and so on. They lead erratic lifestyles, they move around a lot in the local area. Some of them get itinerant work up on farms and things, so they're in and out of different locations with different addresses. And sometimes they find themselves in overcrowded accommodation. So that's the kind of organisation that I'm thinking of when I'm providing examples. This is just a screenshot of the vaccination tool that we've got on the spreadsheet. And it invites you to start off thinking about your service settings. And this is at the core of the DCJ requirement as well. How much control do you have of the workplaces where your workers, and by workers it could mean volunteers, students, agency people. Are you sharing space? Are you co-located with another organisation? What are their policies? Are you moving in and out of a neighbourhood centre where there's lots of other stuff going on? Or are you actually working out in community where you have very little control over what people are going to walk into? So in this example, we're thinking about an outreach model, we're thinking about drop-in centres, we're thinking about office administration. So these service settings, if you use our spreadsheet, would each come up on a different row because they would have different hazards associated with them and different factors that might increase the risk of infection and transmission. So then we invite you to think about the kind of activities that go on in those locations, because it's how you use those service settings, what's actually going on that is significant. With an interview-based kind of casework information model, you might think, well, we can just do it all over the phone. That might be challenged when you talk to staff who say, you know, I work with people for whom a phone call is always forgotten. They never fill out the paperwork properly unless I sit with them. You know, we need to actually be working face to face. Other sorts of activities that might have particular risks, if you've got a cafe, if people are coming in and using laundry, and that's very different from an office or an admin location. So the key conversation then is what actually causes a hazard. It's not the fact that you operate a cafe, it's the behavior within that cafe. Are people physically distanced? When we were all required to wear masks, were they compliant with wearing masks? If you are in an LGA where there's high rates of transmission or community prevalence of COVID, it's obviously going to be a very different conversation here and now as you're doing the risk assessment. But it's something that you might want to keep an eye on for the future. You might want to have a scenario plan. We haven't built that into our model, but you might want to say, this is what we're going to take to the board and the management committee for decision this month, but we also anticipate a scenario where if things went a lot worse in our LGA, this is the path that we would go down in relation to risk controls, in relation to things like rapid antigen testing, in relation to mandatory vaccination. So think about what increases the likelihood of transmission. Think about the people that are involved in the actual work. In my imaginary scenario, there's a particular profile of the staff workforce, and you know, they might all be healthy, but you might also have a group that are a lot older, and you need to take account of that as you're doing your risk assessment. So you might want to just think to yourself, given this kind of quick snapshot of an imaginary organisation, would you say that there was a low level of risk, a medium level of risk, or are things critical? And then you might think, well, what kind of controls would this sort of organisation have in place? How effective would physical distancing be? How effective would health promotion be? What's the risk rating with those controls that you can implement or you are already implementing? This is a risk matrix, and this is something that DCJ has shared as well. The trouble with COVID is that the severity for unvaccinated people is in that very high and critical area. We used to think that, you know, younger people weren't so badly affected, and you know, that hasn't been our experience through the Delta variant, and there may be more variants obviously to come. So thinking about the severity and thinking about the likelihood, given the workforce broadly defined that you're part of, is really at the nub of doing your risk assessment. So then you get on to something which you do need to debate. Your board, your risk committee will help you as a leader think through as well. What sort of risks remain with all those controls, with the PPE, with the open windows, with the outdoor settings? Is vaccination something that you consider to be necessary as a precaution? Okay, in terms of the hierarchy of things you can do, the problem with vaccination is that it can then lead to complacency around all the other things that protect people. And we know that people can still carry and transmit COVID even though they're vaccinated. So it's not a magic bullet, you know, it's something that is part of the toolkit, part of the suite of things. But thinking through, is it reasonable, given your client profile, given your staff profile, given where you work, given how you work, to put a policy of mandatory vaccination in place. Regardless of your decision there, we would also encourage you to think through other risks that are associated with your risk management plan. There might be financial implications. There might be morale concerns. All this needs to be part of your management plan. A health and safety concern will be a priority over and above any other priority. But they are things that need to be thought through to operate a sustainable organisation. We're going to touch, when we come to the questions, more on some of the additional record keeping implications and privacy implications that a decision to require vaccination and explore with people what their health status is if they've got an exemption. But that might be an additional control that you want to put in place in support of your policy. And then finally, you will have to get everything up to date and aligned with what you decide to do. It sounds a bit obvious, but we need to make sure that organisations align all their policies and procedures with what they decide to do, what they put in this action plan, because I can just see everybody submitting, ticking it off that they've done it on the 22nd of December and replying that they've done it as they sail into Christmas. But there is a lot of work involved in that set of requirements. You do need to think through how you cope with people that are not able to be vaccinated. Does that mean you need to redesign their jobs? Does it mean that they work from home? That may not be possible in your particular work scenario. So thinking through some of those things as part of this process is really important. So I think that's enough talking from me. I'm really keen that we get on to some of the specific questions that people gave us in preparation for this. So I'll hand back to Megan, who's going to be the chair, and invite Savi and Michelle, I think, to chip in as well.
Thanks, Alison. That was a really nice overview in a very calm and clear way of just mapping out the steps and the thinking and demystifying it a little bit, I think. Just laying out, here's what you need to think about. So thank you for that. Okay, so we asked you to submit questions. And Alison, as she said, rang around people that were registered in the early part of the week and collected some queries. So we're just going to run through them. If you've got other questions that emerge, you can put them in the chat, and if we've got time, we can cover them. How are we going for time? It's about 10:30, so we're going pretty well for time, I think. I would like to wrap up a couple of minutes before the hour, because I know everyone has back-to-back and things can be quite pressured when you bounce from one Zoom to the next. Okay, so just like to welcome again Savi, Manii from Justice Connect and Michelle Dowd from DCJ, who are going to be a part of the team answering the questions. A lot of the questions seem to bounce directly to Savi, so I'll kick off. Good to give Alison a bit of a rest. So how far can organisations go asking clients about their vaccination status? Can we ask regarding the home base, proximity to hotspots, health symptoms, etc.? Savi, over to you.
Thank you. First cut off the rank, and also thank you from me, Alison, for that presentation. I also agree with Megan's comment that it does demystify, and you kind of just realise that most of it is just common sense, but you just need to have a plan for that common sense approach. So thank you. Just on the question of, how, this is a really common one, how do you sort of engage with service users, and how much information can you collect from them about their vaccination status? So basically, unless there's a public health order in place, which actually does simplify things a lot, you can sort of ask that sort of sensitive health information from staff and people who engage with your service without consent. But in the absence of consent, in the absence of public health order, then really it's up to the service user to whether or not they provide that information. So it's up to them. And you have to have a good reason for asking for that information. It can't just be that you're collecting it, you're just monitoring it. It needs to be a reason that functionally helps your organisation fulfil its work health and safety obligations in this case, that you're interested in this information because you have a clear duty to provide a safe workplace or an environment for all the different people that engage with your organisation. So if you can kind of tick those boxes, that it's a legitimate reason why you're asking this question, and it is directly relevant to you fulfilling your discharging your legal duties in providing a safe environment, then you can ask that question. But the person doesn't have to provide that, so you can't compel them to provide it. So then you kind of have to go, well, am I able to refuse to provide services to an unvaccinated service user? So where does the law take you there? You need to kind of consider, as Alison had said, and this would be part of your risk management framework, and all the questions you'd be asking as part of that, the risk assessments, is, what are the types of services that are being delivered, and how does it impact on COVID-19 exposure? Do I have to provide face-to-face delivery? Can I actually try and see this person and service them in some other way that doesn't expose them to others? And what are the services that are being delivered, and how does it impact the likelihood of an employee being infected with COVID-19, or other service users or volunteers or consultants, and the prevalence of COVID-19? So you'd have to kind of consider all of those factors, and then essentially shape a response that that is fit for purpose and that is contextually relevant. So if there's high prevalence of COVID in the community and it must be face-to-face service delivery, then you might consider strongly about how you engage with this person. It might be that your office is closed at that stage and they're not able to do any face-to-face because that's the appropriate thing to do. But if there are alternatives to doing the conventional face-to-face, or engaging with them in the usual manner, then they're the alternatives you need to consider, because you can't essentially have a blanket rule which says we're not seeing anyone who doesn't have a vaccination certificate, unless, of course, it's a public health order. But in the absence of that, it's dangerous to actually have a blanket rule around these things, because what happens is you butt up against anti-discrimination laws. And one of the protected attributes is disability. And if a service user has a legitimate reason for why they're not vaccinated, because it is for a medical contraindication, then and you're just turning them away, then you potentially might have a discrimination claim on your hands. So really, it needs to be a nuanced approach that you take, but all the time also thinking about, how do I service this client? We're potentially an essential service as well. We have contractual obligations through government funding to service clients, and we want to do the right thing and help, but at the same time, we're sort of balancing the health and safety of all the people that we work with and service, etc. So yeah, it can be complicated, but what I would caution just against is making sure that you're not having a blanket approach. And just in relation to the question of, regarding the home-based proximity to hotspots, health symptoms, I think they're completely appropriate things to ask. Again, they don't have to provide that information to you, but if they don't, you can just assume they're not vaccinated and then kind of step into, how do I mitigate the risks as best as possible. Sorry, it's a very long-winded answer.
And thanks, Savi. Michelle, did you have anything you wanted to add there? I'm particularly wondering about that issue about the type of service that's being provided, like the more crisis essential end versus the more community engagement end. Is there any difference in how that's approached?
I think that all comes down to part of your risk assessment. And looking at whether there's alternatives in terms of how service provision can be provided. So obviously, that's more difficult at the crisis end of services, and where face-to-face delivery is required to actually provide the service that's needed. And then you need to be looking at what other controls, risk control measures can you put in place. So things like, is it possible to, do you need PPE, personal protective equipment? Are there ways to kind of modify your spaces, your service spaces? Can you, distance people? Can some of the service, if it needs to be face-to-face, can it be considered to be delivered outside? Is that an option? So it really depends on the particular circumstances of your service site. But yes, I think there is a difference between, that really sort of the pointy end of the crisis services, and accommodation is another issue as well, where, the service must continue. So it's then about implementing appropriate control measures to mitigate the risk as much as possible. I think the other factor that probably comes into play here is generally considering now the overall high rate of vaccination in many areas. That will come into your risk assessment as well as the prevalence of the number of COVID cases. So it's very much determined on the particular sort of set of circumstances that you're working in.
I think one thing I'd add to that, Michelle, that was really helpful. I completely agree with your points. And also the duty under work health and safety obligations that organisations have isn't to eliminate all risks, like just a very unreasonable thing. It's not possible, but where that's not possible, it's doing everything you can to mitigate the risks and minimise them as much as possible, and as reasonably practicable as well. So I think, as Michelle pointed out, like it is sort of a balancing act, and in that situation, it's not sort of, we're not going to, we're just going to eliminate the risk entirely and therefore not see you. But how do we actually deliver a service, but also manage that risk in a responsible way and meeting our legal obligations, which is through the PPE, social distancing, etc. So, yeah, I think that's important to remember as well, and not for organisations not to feel this sort of overwhelming, unrealistic pressure to just actually not expose anyone to any potential risk, because we deal with risks all the time. That's why we have risk management plans. It's just how to manage the risks as best as possible, not to eliminate them, which is usually not possible or practical.
Okay, great. I'll move along. What are the organisation's responsibilities to staff in outreach roles and settings that are beyond their control? So where staff are going out to a range of different contexts and services and courts and so on, and they can't be necessarily mapped at this point in time where staff might be going.
Yeah, look, I think sort of wherever your staff are going and doing work for your organisation, they're sort of deemed to be under your control in a way. So that's why it becomes a concern for employers to make sure that even when staff are out of the office, that they are safe on work time. So I think Alison was going through that helpful sort of, the tool, and she was mentioning that with each different sort of site, you'll have to do a separate risk assessment. So it's not kind of like the one risk assessment for your organisation located in Summerhill in Sydney, but actually all of the different places that your staff go and interact. So risk assessments for all of those, you would do things like, for example, if they have to do outreach to court or at a community neighbourhood centre, check with that organisation to see, well, what kind of control measures do you have in your workplace? How are you controlling the risks there? Just to make sure that maybe that they're aligned in terms of the measures that they're taking with which, I'm so sorry. Sorry, just 1 moment, I'll try and, oh, he's gone. We've got workers here. So, yeah, so I think that would be the thing to do. But there might be a situation where you just feel like it is just too, the sort of the situation is just too changeable. Every day it's a different factor that's coming in, and the risk is kind of up and down, and it's not practical to kind of go sort of back and forth between approaches and shift that response. So, you know, a lot of services have sort of stopped their outreaches and aren't sending staff to external sites at the moment until things settle down and, you know, large cohort of population are vaccinated, which they are now, and then slowly reconsidering how they re-engage with those different services. And then I've been speaking as well to other bodies where they've previously had those outreaches but have gone to an online model, and that's actually worked really well for them. And they're sort of not interested in sort of the flip-flopping of, you know, one week they're on doing outreach and the next they're not, and considering whether they go to a permanent state of online engagement.
Okay, so I'm hearing you say that actually they do need to pretty much identify each of the outreach sites and map those as best and assess those as best they can.
Absolutely.
I still have a question about what if there's a site that you don't know about yet? Does that mean that they can't go to it if you haven't mapped it in your risk assessment? And there's a question in the chat about, do we have a responsibility to do a risk assessment in the work from home setting?
I mean, we do a risk assessment for working from home, just a work health and safety one, just to make sure that people, so that's always been part of the practice.
So with you, for instance, with your builders, does that quantify as an increased risk for you working from home today?
Yes, I mean, they've got a QR code, so they actually all check in, and I'm not sure if I'm meant to check into my own house as well, but maybe that's what we do. We all have to check into our homes. Look, it can sort of get a bit crazy and a bit silly. I think it's what's reasonably practicable, if we can go back to that principle, and not eliminating, there's no duty to eliminate all risks, but that's just not possible. You know, we just cannot control every sort of the degree of people's lives. So yeah, I think like if you don't, for example, in my workplace, for us to go to the office, go to a site, an external site we used to do outreach at, we have to go through a very clear process of first going to the leadership team and getting clearance from that for that, and explaining why that's actually really necessary to do, because at the moment we're not allowed to do that. So I think you need to have a process in place to make sure that there's control being exercised by your organisation around the movements of your staff when they're doing work. So they're not making the decisions about when they go to outreach and when they don't. That there needs to be a centralised process, which the workplace has oversight over and can give consent on.
Okay, all right. I'm just going to jump to the next question, skip that one just for a minute, and go to, can COVID testing, e.g. rapid antigen testing, be used as part of the risk assessment to be able to provide unvaccinated staff and clients with access to the office? And in the chat, there's also a question about boosters, and will boosters impact how people are treated if they don't want to get sort of subsequent boosters? Does that have to be in the risk management plan now? And I think that goes to Alison's point about thinking through future scenarios. Who will I throw that one to? Maybe, Savi, if you could just start off with any comments from the legal point of view.
Look, I just feel like this would be just another control measure. I feel like there's a health response to this as well, which I'm obviously not across. I know that I was speaking to a law firm actually recently who is implementing this practice where everyone that wants to come into their office has to go through a PCR test. And there was discussion about the practicality of that, because actually to do that properly, it's quite invasive. You self-administer and you really have to just get into the nasal cavities and throat. So if anyone who's had those COVID tests know how painful that can sometimes be. So, you know, are people actually going to be doing it properly and correctly? Is it going to be accurate? So it's not a foolproof thing, but it's just one weapon in your arsenal, I would say, that you could use in managing the risk.
Okay, Michelle, over to you. I'm just aware that time has marched ahead.
I totally agree with Savi there. I think, you know, rapid antigen testing it is another tool that you can consider. There are a few different considerations. One would be availability and cost. And then again, around clients, it's a screening measure, but it's one that client would have to consent to and agree to. You couldn't demand that a client go through a test. I think there's reliability issues that you'd need to consider too with the rapid antigen testing. We've heard that they're not as reliable as the PCR testing for full tests. So it is just another tool in your toolkit that you can consider using. I would imagine that it would be more applicable to some circumstances than others. Maybe accommodation settings would be more of an appropriate use than sort of drop-in centres or services where you're doing face-to-face service delivery, but you can more easily implement other controls like physical, you know, socially distancing or ventilation or use of masks and PPE. I think it's that balancing act, again, of choosing the most appropriate tool as a risk control measure for the circumstance.
Okay, thanks. Alison, did you have anything to add on that?
Not really. I mean, I just think that this isn't a piece of work that you can future-proof, but flagging to people that things like, you know, obviously boosters are going to be part of the world next year, maybe more so than they are this year. So, you know, writing that into your policy now, I'd say would sort of save you a bit of work down the track. So just thinking as much as you can, and as the others have said, making the best decision with the information that you've got available seems like the logical thing to do. I
think that's a good point, Alison. This is a very fast changing space. And at the moment, you know, the government hasn't said that you require a booster shot to be considered fully vaccinated, but that may change.
Yeah.
So I guess the point is here, yes, you can try to sort of think ahead and build in scenarios of what might be happening. But the other point is that your risk assessment needs to be a dynamic document that you may need to change, and you should be looking to update regularly when there are changes in circumstances in either, you know, the laws, in public health orders, circumstances around vaccination requirements. So it is something that you're going to have to come back and regularly revisit as things change.
And you can word your policy in such a way as, you know, rather than saying vaccination equals double vaxxed, you could say vaccination equals, you know, as many vaccinations as is mandated by the health department or something, and it just means you don't have to then go back and redo that work if there is a shift of the goalpost.
Yeah.
Okay, I'm just aware again of the time, so we've got a few more questions here that relate more to implementation, and I'm just going to, with that second point there, we have employees, volunteers who are vulnerable rather than clients. Does this mean a risk assessment indicates a mandatory vaccination is required? I think the point there is that the vulnerability of the employees and the volunteers is definitely a part of your consideration. And in the interest of time, I'm going to just move on from that one. So the top point there, our management committee policy mandates double vax, but we have staff and volunteers who are unwilling. This is the issue of the day. What can we do? Savi, over to you.
Yeah, so you'd have to, obviously, if there's, you know, you've gone through that process, you've gone through a consultation process of implementing this vaccination policy and mandating vaccination in the workplace, and then you have people who are resisting that, then you'd have to, I guess, what you do then in that situation is have a conversation about, well, what are their concerns, making sure that they, the exemptions that are spelled out in your policy are able to be satisfied. So usually you would say that there's a medical contraindication, and that maybe link it to what's set out in a public health order, for example, because I have fairly clear parameters around what constitutes a medical contraindication and how you support that with evidence. So you would request that information, and if it's not forthcoming or there isn't that reason available, or the documentation provided is not sufficient, doesn't meet the requirements in the policy, then you would have a conversation about, well, what's, is there something, do you need more time, for example, to get vaccinated? That might be an issue. And if none of those sort of, I guess, lead to anything, and really the role isn't one where you can make adjustments to accommodate that person. For example, you might say, look, in your situation, then we suggest that you work from home and your work can be done from home. If those options aren't available, and you don't have to do that, you would go through a disciplinary process where essentially they're not following a lawful and reasonable direction from their employer to do something, and you put them on notice that the implications might be loss of employment, and if that kind of plays out and nothing happens, then there'd be termination. With a volunteer, yeah, sorry, go ahead.
Is legal advice recommended if people are in that scenario?
I would definitely recommend, just because it can be so difficult to know, even in the first place, whether or not the approach of mandating vaccines in your workplace is the right approach, and whether it's reasonable in the circumstances. So then when you go to applying that, and it can eventuate in potential termination of staff, I would definitely recommend that organisations do take some preventative legal advice, just to make sure that they're correctly discharging their duties and they're properly handling the scenario, and they're not going to end up in a sort of unwanted unfair dismissal claim or anti-discrimination claim.
Yeah, okay. All right, there's a question in the chat around can mandatory vax be put in an advertisement for a new position? I think the answer is yes.
Yes, that's correct.
No problems there. Does the policy only cover DCJ funded staff in DCJ funded services, or does it apply to everyone in the organisation? Correct me if I'm wrong, but I think it's the whole organisation.
Yeah, so the way that the policy is framed, we refer to workers, which is also the definition that's used under the work health and safety legislation. And a person is a worker if the person carries out work, paid or unpaid, in any capacity for the service provider. Now, the scope of our policy is that it applies to service providers in respect of the services they are contracted to provide on behalf of DCJ. So if you have a whole section of your organisation that has nothing to do with delivering DCJ services, then the policy doesn't apply to those workers necessarily. But in practice, I would imagine that it might be difficult to separate out different pockets of your workplace. So that would be a consideration that you could take as an organisation, looking at the whole of your workplace, about whether you're requiring the same types of approaches and risk control measures across all of your staff.
Okay, I'll move along because I'm aware we're running out of time. In record keeping, what are an employer's obligations regarding record keeping? What if staff don't want to disclose their vaccination status? Does this mean more controls of other types are required if they don't tell you? Do you assume they're unvaccinated? Savi?
Yeah, so I think I mentioned very early on that if the collection of information about an employee's vaccination status isn't required or authorised by law, for example, through a public health order, then you don't have an automatic right to that information. There needs to be consent. The collection of this information needs to be reasonably necessary for you to discharge your duties under work health and safety laws. So you can collect on that basis if you can satisfy those requirements. Once then those details are collected from the employee, so you have vaccination status, then the Privacy Act doesn't apply to that information anymore. It actually means that it's dealt with under general law, including workplace relations legislations, which contains less stringent privacy obligations. So yeah, obviously you still want to limit the amount of information you're collecting and the purpose for which you're using it, and try and really limit it to the essential information, not a fishing expedition. But yes, you are sort of permitted to keep those records of staff. If the staff don't want to disclose the vaccination status, that depends. If you've got a mandate in place that requires vaccination, well, that's a different scenario, because then you're talking about a disciplinary process potentially, or making sure getting clearance around whether they have a medical exemption. But if that doesn't apply, then you'd want to exactly apply more controls to make sure that the safety of that staff member is adequate, but also the people that they're being exposed to, the clients and other staff too. So, you know, making sure that you have social distancing, PPE, all of those things.
So if you don't, the last question, I think, if you don't have the mandate in your policy, can you ask to see people's vaccination certificates?
If you don't have a mandate, yes, you can, but it has to be reasonably necessary. So I think then you're making decisions about how you organise the workforce. So you still can ask 100% that question. You don't have to have a mandate. You're not saying everyone must be vaccinated, but on a case-by-case basis, you're actually trying to work out, well, who is and who isn't, and how do I best organise the work that people are doing in my organisation and the interactions they're having to most minimise the exposure to them and to others that interact with the service.
Yeah, so more a conversation, discussion.
Exactly.
We're not mandating and trying to do it in a sort of consensus-based way.
A completely consensus-based way. They do not have to provide that information to you, but then you can assume that they're unvaxxed. Yeah. Great.
Okay, handing over to Alison to wrap up. Apologies for running a little over time.
Okay, final points. There's some great stuff happening with DCJ and REBIC. You're probably aware, but there's a whole bunch of workshops on this subject. So if you want more information, then jump on the DCJ website. I think they've emailed people invitations as well, but they're starting tomorrow through to the 24th of June, I believe, 7 different sessions targeted to different sectors. We've put some resources and some FAQs up online, and we can add the FAQs that we've used today and your chat questions into this document. So if you wait a few days, there's lots more information around record keeping and volunteers and stuff that we haven't covered today that might be useful to you. So it's there. And there's obviously lots happening in this space, but a big shout out to Justice Connect, who've done some amazing stuff, you know, really nice, clear diagrams and webinars and FAQs that we've built a lot of what we've done from. Aqua have got some legal advice and training. The Fair Work website, you probably found the Safe Work website. So there is information out there. All these links are in our documents, but we don't want to sort of make people even more confused. I think, you know, as we said earlier, a common sense approach and making the best decisions that you can make with the information you've got available is where things are at.